In this video, we'll talk about the different treatment options for atrial fibrillation. I think it's best to break down the different treatment strategies into three main categories: rate control, rhythm control, and finally, anticoagulation. So let's first talk about rate control. In Afib, we often talk about a fast, irregular heartbeat, sometimes going more than 100 beats per minute. Medications are what's used to slow the heart rate down. Beta blockers like metoprolol or carvedilol, calcium channel blockers like diltiazem and verapamil, and less commonly digoxin are used to slow the heart's rate down. These medications typically do a good job of slowing the heart rate down, but they don't change the heart's rhythm or get rid of the irregular heartbeats. In order to do that, let's talk about options for rhythm control. Here, the objective is often to restore a normal heart rhythm called sinus rhythm. Antiarrhythmic medications are commonly used to achieve this. Medications such as dronedarone, flecainide, propafenone, and amiodarone are some of the common names. Sometimes, these medications are used in combination with a very common procedure called cardioversion. In this procedure, you're carefully monitored, normally in a hospital or a clinic. You're connected to a machine called a defibrillator, which can deliver an electric impulse. This resets the heart rhythm back to a normal sinus rhythm. Another strategy that's often employed is called catheter ablation. In this procedure, a thin tube called the catheter is actually passed all the way up to the top chambers of the heart. From here, the abnormal Afib impulses can be detected and eradicated. This procedure is done by a specialized cardiologist called an electrophysiologist, or EP for short. So how about that third category of anticoagulation? Well, as we talked about in our other videos, in Afib, the blood doesn't flow normally through the heart, which can lead to a blood clot. Blood clots increase your risk of having a stroke. To prevent blood clots, we often use anticoagulation medications such as warfarin. And although warfarin is helpful, it requires frequent blood monitoring, so some people choose to take a different medication, such as apixaban or rivaroxaban, both of which don't require blood monitoring. So you can see, there's really a lot of different treatment options and strategies that we use for Afib, and it really does require a discussion with your doctor to learn what's best for you. For more information like this, go to Learnyourself.org.